Hello, everyone. Today we will go over Section 6 of the Tribal CCDF Plan Preprint, which covers how to ensure equal access to quality childcare for low-income children. Just as a reminder, the blue M and purple L boxes at the top let us know that this section of the plan is for tribal lead agencies with medium or large allocation sizes. I'm going to pass it over to my colleague Teresa to give us a short demonstration of how you can access all of our resources on our website.
Thank you, Sarah. So the first link that I'm putting in the chat box for you is going to take you to the TCBC website. I'm sure that you are getting pretty familiar with what this looks like after all of the help that we've been supplying on each session. So if you scroll down here, you can see that there's a lot of resources available. You may want to take a special look, fiscal on-demand sessions, but we're going to concentrate on the tribal preprint resources, which is under this icon right here. If you click on that, it takes you to this page, and I am going to go ahead and drop a link straight to this page into the chat box for you. There we go. So once you get here, you scroll down and you can see that all of our sessions are here and available for you. The one that we are presenting currently is this very beautiful Section 6 on ensure equal access to quality childcare for low-income children. You click on that, all of the resources are available for you here. Our PowerPoint slide is there, as well as tips and consideration documents, and the Section 6 resource directory is available. So I will go ahead and pass it back to Sarah, and we can get our presentation going for you.
Thank you, Teresa. So we're also just going to take a minute and introduce ourselves. We will be your presenters for today. So my name is Sarah English, and I serve as the Technical Assistance Specialist for TCBC for Regions 1 and 6. And I'm going to now pass it over to Dee.
Good afternoon, everyone. My name is Dolores Frollet. I am is part of the Tribal Childcare Capacity Building Center as a subject matter expert on construction and major renovation. I'll pass it over to.
Yeah, Saguli, everybody. My name is Nazba Hill. I come from the Navajo and Oneida Nations, and I am the tribal subject matter expert for subsidy administration. So nice to be here with you all this afternoon, and I will pass it back to Sarah.
Thank you. As we move forward with today's session, please feel free to unmute and stop us if you have any questions, or if you're more comfortable typing it in the chat box. We want to remind you that this is a safe space to ask all of your questions, and please feel comfortable to stop us at any time for more clarification. As we wait for everyone to join, we invite you to introduce yourself in the chat box, which can be found on the lower part of your Zoom window. Let us know who is here today. We have a few objectives for our time together today. We will explore and define how your tribal lead agency will provide direct child care services. We will identify ways to access market rates to ensure payment rates cover the cost of care. We will review strategies to establish adequate payment rates and recognize ways to implement generally accepted payment practices and ensure the timeliness of payments. In this section, you're going to describe the types of direct services your tribal lead agency is offering, how you assessed childcare market rates, established adequate payment rates, and how you ensure that your tribal lead agency is implementing generally accepted payment practices and timeliness of payments. Let's begin with subsection 6.1. Subsection 6.1 covers the description of direct child care services. A core purpose of CCDF is to promote parental choice and to empower working parents to make their own decisions regarding the child care services that best suit the family's needs. In supporting parental choice, the tribal lead agency must ensure that families receiving CCDF funds have the opportunity to choose from the full range of eligible child care settings and must provide families with equal access to childcare that is comparable to that of non-CCDF families. Tribal lead agencies must have strategies to increase the supply and improve the quality of childcare services, especially in underserved areas. This section addresses strategies that the lead agency uses to promote parental choice, ensure equal access, and increase the supply of childcare. An overview of equal access. So here is a way to see how all the components of equal access work together. To ensure equal access, the following components need to be included. A choice of a full range of providers is available to the families. Adequate payment rates are based on an assessment of the cost of care. Base payment rates support healthy, safety, and quality in staffing. Cost for higher quality care is addressed. Co-payments are affordable. Payment practices support equal access. Differential payment rates may be considered. Additional facts are considered. And all these components together ensure equal access to quality childcare for low-income children and their families. We will explore these components as it relates to your tribal CCDF plan throughout this presentation. We're going to also look at a resource spotlight for you, as you may want to refer to the American Indian and Alaskan Native Guide to Subsidy Administration for Medium and Large Allocation Grantees. We're going to drop this link into the chat for you. And remember, all of these resources are available on your resource directory as well. A choice of a full range of providers is available. The CCDF final rule recognizes 3 types of care: center-based, family child care, and in-home child care. You would have chosen your types of care in section 1.7 of your plan. You may offer care through a tribally operated center, which would fall under the center-based care option, or family, friend, or neighbor care, which would fall under the family child care option. These choices support families' needs and preference for their children. Tribal lead agencies should develop and implement strategies to increase the supply and improve the quality of child care services. These strategies should address children in underserved areas, such as infants and toddlers, children with disabilities, as defined by the tribal lead agency, and children who receive care during non-traditional hours. Some guiding questions to consider are: how do you let parents know about all these provider types your tribal lead agency offers? How can you educate parents about making the choice of which provider to use for care? 6.1.1.1 Child Care Services, Limits on In-Home Care. If your tribal lead agency offers in-home care as indicated so in section 1.8, there are some allowable limits of in-home care that the tribal lead agency can implement. For example, restrictions on in-home care can include the following: a minimum number of children due to the Fair Labor Standards Act minimum wage requirements, a minimum provider age, requirements about the hours of care provided, only allowing care by relatives, only allowing care for children with special needs or medical conditions, or possibly additional health and safety requirements. Tribal lead agencies who choose to adopt policies that limit the use of in-home care, they must describe these limitations in their CCDF plan, including reasons for such limitations. If your tribal lead agency has other limits, you will check the Other Describe box and write a brief description of your limitations. 6.1.1.2, funding direct child care services by the tribal lead agency. How will you fund direct child care services? You can choose from the following funding mechanisms: certificates, grants or contracts with approved child care providers, and a CCDF-funded tribally operated center. Remember, tribal lead agencies with large allocation sizes must operate certificate programs. Tribal lead agencies will only check the boxes that apply to the type of funding mechanisms they will use. If you are a tribal lead agency with a medium allocation size, you could choose to fund child care services exclusively through a tribally operated center. If so, you will check the Yes box under 6.1.1.2, question 1. When the Child Care Automated Resource Reporting System, CARS, will then take you directly to section 7, where you will continue completing your tribal CCDF plan. If you check the No box, you will continue to the next question. CCDF direct services may be provided through grants or contracts that allocated slots with a provider who offers child care services. Some of the benefits of choosing to offer grants or contracts is to ensure ongoing space for hard-to-place aged children in child care centers in your service area. Grants and contracts may also increase access to high-quality, stable child care for children, stabilizing revenue for providers, and reduce the administrative burden for parents and providers. A benefit of paying for child care slots using grants or contracts is the guaranteed space for tribal children. We want to remind you that these are just some areas you can focus on when offering grants or contracts. There can be others. If you have other ways to use grants or contracts, these should be described under the Other section. We understand that some people may be uncomfortable with using grants or contracts because it is something your tribal lead agency has not tried before. We will provide some examples that can help you consider whether grants or contracts could be beneficial to your community or not. Do note that there are times that grants or contracted funded slots remain open. This is allowable under CCDF regulations. In Table 6.1.1.4, tribal lead agencies who choose to use grants and contracts will check the boxes that apply regarding how they are used in child care programs for different populations. This table should appear in CARS only if you responded yes to 6.1.1.3. If you choose to offer CCDF direct services through grants or contracts, do you use them to increase the supply and/or to improve the quality of child care programs? For example, you may use grants or contracts to purchase infant and toddler slots at a local child care program. Since there is a low supply of infant and toddler slots in the tribal community, this would be a strategy to increase the supply of care. An example of increasing quality might be purchasing slots from a family child care provider who offers instruction to the children in the tribe's language. So now we want to hear from you. As you can see, there are a few questions on the screen. When you think about your tribal community, which groups of children would you consider including in a grants or contracts to increase the supply of care or to increase the quality of care? Please feel free to come off mute and share some ideas that you have, whether they're things you're considering or things that you've put into practice. In person, we used a ball to pass around as kind of our version of a talking stick to involve other participants and to share some information. So even if you want to volunteer somebody via chat or put some of your ideas in the chat of some things that you might consider, or maybe even some things that are in your mind that you're concerned about when you're looking at grants or contracts.
I think with grants or contracts, I understand how they work, but it's like if you have budget, if your budget might be constrained, or you have a lot of children, you're worried about having enough money to pay for all the children for each fiscal year, then it's hard to let go of your money to increase the supply when you don't know. You might pay for a slot and then it may go unused. And so I think that's what I've had to deal with, is trying to make sure that there are enough infant and toddler slots, but then also a lot of the providers in our area do not offer. I mean, it's such in high demand. And so right now we're just trying to increase our services, expand our own tribally operated childcare services to include that age group, because it's in high demand. And then the parents are they're not okay with going with low quality, and a lot of it in our area is lower quality, and they don't want their child there, even if it's available.
Wonderful. Thank you for sharing, Carolyn. We do have a couple of comments in the chat box. Again, saying infants and toddlers, that's a common area we hear about. And then after school care, that before school, after school, summertime care for our school age children is really a kind of a hot commodity as well. And that may be something that you consider looking at as part of your grants or contracts. One of the comments we also seen was children who have special needs. So there may be a provider in your area who specializes in working with children with autism or children with feeding tubes. And so developing a partnership or having a couple of spots in places in those specialties may be of need for your tribal community as well. Thank you all for sharing. So now that we've heard some of these ideas, do you guys feel comfortable with grants and contracts? If you have any other questions or concerns regarding grants or contracts, feel free to drop them in the chat. And we're also going to highlight this resource for you here, which is using grants or contracts to build and stabilize childcare supply. It's a tips and consideration sheet for all allocation sizes. And this is really just an opportunity for you to review and see some of the things that you might want to consider when you're looking at implementing grants or contracts. In 6.1.2, we refer to methods to inform families of child care provider categories. Tribal lead agencies will check the boxes that reflect the options of how they involve parents and inform parents of the full range of child care provider categories, which include center-based child care, family child care, in-home child care providers, and other provider types as applicable. Tribal lead agencies will check the boxes that apply regarding the methods they have in place to inform families of their child care providers. If you check the other box, you will need to describe the method in place. Tribal lead agencies can refer to section 7.2 of the Tribal Plan Preprint to make sure the language is aligned with how they ensure their information is easily accessible to parents. So now I'm going to pause for a moment and see if we have any lingering questions over the information we've covered so far. Okay, thank you all, and I am going to pass it to Dee.
Awesome. Thank you, Sarah. So here in subsection 6.2, we'll be discussing childcare market rates. You'll hear terms such as market rate, payment rate, and cost of care. So market rates are the going rates of childcare costs in each state or the area that you're in. Payment rates refer to the rates the tribal lead agencies choosing to set for payment to the child care program. The cost of care refers to what the child care program chooses to charge and can be different by areas such as rural and urban settings. 6.2 is assessing child care market rates. The final rule exempts all tribal lead agencies from the requirement to use a market rate survey or an alternative methodology to set provider rate payment rates, because many tribal service areas are in the rural, isolated areas, making such requirement difficult. Although they are exempt from the market rate survey requirement, lead agencies must set sufficient base payment rates to provide equal access to the full range of childcare services and must set rates that cover the cost of providing higher quality care. Here in 6.2.1, determining cost of care, tribal lead agency at their option may still conduct a market rate survey or an alternative methodology approach, or to use the state's methodologies to set payment rates. If using an alternative methodology, the lead agency may use child care resources and referral data to access child care costs in its service area. In section 6.2.1.1, lead agencies will check the boxes that apply regarding the sources of information used in accessing the cost of care within their service area. If you check the other box, you'll need to describe the methodology that you have chosen. Let's move on to subsection 6.3. We will now discuss how to establish adequate payment rates. This subsection of 6.3 of the Tribal Plan Preprint is for tribes, again, for medium and large allocation sizes. Adequate payment rates are based on the assessment of the cost of care. Although they are exempt from the market rate survey requirement, lead agencies must set sufficient base payment rates to provide equal access to the full range of childcare services and must set rates that cover the cost of providing higher quality care. At a minimum, tribal lead agencies with large allocation sizes must operate a certificate program and are required to show how payment rates are adequate, including a description of how payment rates are established, how they support the health and safety, quality and staffing requirements, along with the cost of providing higher quality care, and where applicable, and how they support cultural and linguistic appropriateness. Tribal lead agency at their option may still conduct a market rate survey or an alternative methodology approach, or use the state's methodologies to set payment rates. Tribal lead agencies may pay providers more than their private pay rates as an incentive or to cover costs for high quality care. Here in 6.3, tribal lead agencies are required to establish payment rates for child care services that ensure eligible families have equal access to child care services comparable to those services provided to families not eligible to receive CCDF services. In 6.3.1.1, you will describe your process for establishing payment rates. So for example, you could collect payment rate information from the state's market rate survey, collect information from providers to see if the current payment rates cover the cost of care, collect satisfaction surveys from parents to gather information on the quality of care at your current payment rate coverage, and look at the current CCDF budget to determine if you have additional money available to increase your payment rates. We want to just remind you that you do not have to use the state payment rates. You could look at the market rate data from the state's market rate surveys to consider how they have set their payment rates. You can also collect cost information from providers in your service area to help you determine what your payment rates are going to be. One strategy for exploring what impact different payment rates will have on your CCDF budget is to consider projecting provider payment rates for different age groups and over different periods of time, whether that could be monthly, every 6 months, annually, to get a sense of how different rates will impact your availability of funds for providers. The Tribal Child Care Capacity Building Center has a projecting CCDF spending for direct service tool that you could use to project your direct service costs. In an on-demand session, you could also view to get a better idea how to use the tool. You could also request a one-on-one demonstration of the tool by a TCBC team member through your regional office. Under other resources, the provider cost of quality calculator tool from the National Center on Early Childhood Quality Assurance. We have provided the links of these resources in the Section 6 resource directory, which y'all will get a copy, which you all could get a copy on that link that we showed you earlier in our session, how to receive resources. Base payment rates support health and safety, quality, and staffing. Tribal lead agencies often set base payment rates on what providers in the area are charging that support the cost of care. So which includes all the things that providers take into consideration when setting their rates, like salaries, training, supplies, child ratios, and the costs associated with running the child care home or center. Tribal lead agency must describe their base payment rates and they enable providers to meet the health, safety, quality, and staffing requirements under CCDF regulations and how it supports quality and meets the needs of the tribal community they serve. So in examples like the cultural and linguistic appropriateness. Here in 6.3.2, establish base payment rates. Lead agencies are required to set base payment rates at least at a level sufficient to cover the cost to the providers of the health and safety, quality, and staffing requirements included in the CCDBG Act and the final rule. In section 6.3.2.1, you will describe how the lead agency's base payment rates enable providers to meet those requirements. So an example is a lead agency may state they have gathered information using the process described in the previous question, review the information to identify trends or concerns, and found that the current provider rates were not high enough to allow families to access high quality childcare, and they had an excessive of money within their current and previous CCDF budget. Using the CCDF projecting spending for direct services tool to calculate the increase to ensure the budget would be able to cover the increase. Increase the base payment rates to be higher than the state's rates to allow families to access a high quality of care. 6.3.3, lead agencies will describe how base rates support the needs of tribal communities and describe how the tribal lead agencies' base payment rates support quality and meet the needs of the tribal communities they serve and where applicable, cultural and linguistic appropriateness. Here's an example that a tribal lead agency could include in the description is the base payment rates were determined based on the nature of the care provided in a community and based on cultural norms. 6.3.4 payment rates should reflect the variety of care offered in the tribal lead agencies program. An example would be different rates based on the child's age and the category of care. So lead agencies are reminded that payment rates cannot be based on a family's eligibility, such as receiving TANF or participation, education, or training. Include all payment rates and the definition of service area in the attached payment rates. 6.3.4.1 within the fiscal year 2023-2025 Tribal CCDF plan, the way a tribal lead agency provides payment rate is different than in your previous plan, where you only attached a copy of your payment rates. For center-based providers and family childcare providers, provide the full-time weekly base payment rate for each age group that the tribal lead agency serves. If weekly rates are not published, then the lead agency will need to calculate its equivalent. If the payment rate's different, use the most common payment rates for center-based providers and family childcare providers. In section 6.3.4.1, you will enter your full-time weekly rates for center-based care for infants at 6 months old, toddlers at 18 months old, preschoolers at 4 years old, and school-age children at 6-year-old, and based on full day, full year rates that would be paid during the summer. 6.3.4.2 for family childcare providers, you will go through the same process and provide your weekly base payment rates for each age group. Again, infants at 6 months old, toddlers at 18 months old, preschoolers at 4 years old, and then school-age children at 6 years old, and based on that full day, full year rates that would be paid during the summer. Another payment rate example is looking at this payment rate example here. You can see the example as a weekly rate for each age group has been calculated and entered into the table for center-based care and family childcare. When you update your payment rates, be sure to also add an effective date to reflect when your new payment rates do go in effect. You can use a table similar to this to attach in your plan in CARS. In section 6.3.4.3, you will list the effective date of the payment rates, including tiered or differential rates in the payment rates attachments. Differential payment rates may be considered that lead agencies can set different rates from different ages of children. It's simply more expensive to care for infants and toddlers due to lower ratios need to be attempted to their needs. It's also possible to have higher rates for certain difficult to place age populations, such as school age and after school care. It is also possible to have higher rates for providers who are caring for children with special needs who need an additional level of care and may require specialized or more expensive care. Lead agencies have the flexibility to set different rates in different parts of their service area. Some tribal lead agencies have service areas that include expensive urban centers and more rural areas with lower operating costs. The grantee can set their rates appropriately as compared to other providers serving children who may not be receiving childcare assistance. This is also a great option when it comes to incentive care in an area that is otherwise known as childcare. Tribal lead agency may pay providers offering during non-traditional hours higher rate as incentives for that care. Tribal lead agency can choose to establish tiered rates, differentials, rates, or add-ons at the top of their base rate as a way to increase payment rates for targeted needs. So, for example, paying a higher rate for children with special needs as both an incentive for providers to serve children with special needs and a way to cover the higher costs to the providers to deliver care to children with special needs. Here in 6.3.5, it is also possible to pay rates to account for higher quality programs, such as program meeting certain thresholds set by the tribal lead agency or those who are participating in the state or tribal quality rating and improvement systems. Lead agencies may choose to pay higher rates to those providers who speak only their tribal language to the children they are serving. So for example, your relative providers or your family child care providers. Additionally, tribal lead agencies may explore opportunities to pay higher rates to providers who encourage or conduct demonstrations of traditional culture with their children in their care. Paying higher rates also can also be an incentive for providers to help them reach a higher quality rating, therefore providing a higher quality care level. So in addition to setting differential rates, like we have discussed, tribal lead agencies have the option of having rate add-ons that are added at the top of their base payment rates. This is really similar to the differential rates, but instead of having a different set rate for each possible area, the lead agency pays a percentage addition to the base rate. So another example, for example, a lead agency could choose to pay a provider for an additional 5% on top of the base rate to providers who have entered their child development associate credential. Rate add-ons are often used to encourage providers to increase and sustain their program quality. Rate add-ons can also be a powerful tool for language and cultural revitalization. So let's take a look at this example of differential rates and tiered payment rates. In the first table on the left, this tribal lead agency has decided to add an additional percentage to the base rate for providers who provide cultural programming. Those who care for children with special needs and live in a certain part of their service area where a few childcare slots are available. In the second table, they have opted to offer tiered payment rates for those providers who have elected to participate in the state's quality rating and improvement system. They will receive an additional amount to their base weekly rate based on the level they have reached within the QRS system. In this example, tribal lead agency also provide information that a provider is eligible for all the differential rates and tiered payment rates they met. For example, if a provider serves children with disabilities with the identified service area and meets the level 2 of the QRS, they receive a 5% increase in a payment rate and a 2% in the base rate payment rate, an additional $50 each week for the child they served. So hopefully this is a very good way to take a look at your differential and tiered payment rate. I will now pass this next part of our presentation over to Nazba.
All right, thank you, Dee. Before I continue, I just wanted to let Kara know she had a question in the chat. Can tribally operated centers center weekly rates be different from state licensed centers? And Sarah sent you a response. So hopefully you can see that response in the chat. And let's talk about costs for higher quality care. So tribal lead agencies have the flexibility to set their own rates, and those rates should be reflective of the type of care offered. A tribal lead agency may offer different rates for different types of care, but the rates can never be based on a family's circumstance. So payment rates should reflect the variety of care offered in your program, must consider the cost of care to providers, may be different for different kinds of care, cannot be based on a family's eligibility or circumstances. And this can be accomplished either through your base payment rates or using rate add-ons, differential rates, or tiered payment rates. Now that you proposed your rates for the next plan cycle, how do you know those rates ensure equal access? Equal access would offer children receiving CCDF subsidies access to the same services. For example, type of care or quality of care as children not receiving CCDF subsidies. To certify, check only that those that apply and provide a description of the rationale that the tribal lead agency used to determine equal access. So tribal lead agencies must provide a description of the rationale that they use to determine equal access. Some examples can include, but are not limited to the following: feedback from parents, feedback from providers, the use of tiered rates or differential rates, payment rates are higher than the most recent state or tribal market rate survey. Let's take a moment to review some of the reasons to consider higher base rates, differential rates, and tiered payment rates. Paying a higher base payment rate allows providers to remain financially viable despite the fluctuations of enrollment of children, whether due to temporary child absences or large-scale absences, such as those incurred during the pandemic. Paying tiered base rates to programs with a higher quality rating and improvement system rating can incentivize providers to improve quality, as higher rates cover the increased costs of operating high quality programs, allows providers to remain financially viable, again, despite the ebb and flow of children, whether due to temporary child absences or large scale absences. Differential payment rates can offer an opportunity for providers to receive a higher rate of payments for supporting non-traditional hours of care or offering cultural and linguistic opportunities. Cultural components can be considered high quality and also serve as an economic opportunity for providers who are willing to collaborate with tribal cultural activities. So we will pause here for a quick activity based on the information we just went over. We'll be using Slido to capture your thoughts. And so we're going to put the Slido link in the chat box for you to access the link, and then we'll project the Slido onto the screen. Once you are able to join slido.com using the link, you just want to enter your answers into the questions that are on the screen. You can also use your phone and use that QR code there to get to the Slido website. Or you could just do slido.com and put in the TCBC VB code there as well. All right, so can we transition to the questions that we would like them to answer? So the first question is, what goes into determining your base payment rates? And you can just go ahead and put any answer in there that you think goes into determining your base payments based off the information we just shared, or maybe how you determine your base payment information. Yeah, income. I see somebody else is typing. The cost of providers, definitely. Family size. I see a couple more people typing there. Did somebody put in the chat, insurance and child support paid? On the screen, tribal goals, the quality of the center. And I see market rates, okay. Health and safety requirements, great. Yeah, how are you helping these childcare providers meet the minimum health and safety requirements? Those are all good examples of things you would take into consider when you are determining your base payment rates. And then it says, we have always used a market rate survey to see what the provider rates are in our service area. And then child support and medical insurance payments paid by the applicant. Let's move on to the next question. The next question is, how would your base payment rates and your differential or tier payment rates affect providers? Right. So if you're adding that differential rate or tiered payment rate, maybe to providers who have a higher QRS system, or maybe they are offering a cultural and language component that no other providers have. So you have a tiered payment rate for them. How would that affect them? Great answer. Encourage the higher quality of care. Definitely. It's going to incentivize your providers, right? I think it would prompt them to consider quality activities, more likely to accept our tribal children. Yeah, those are some great answers too. And if these providers know that you are maybe offering a tiered payment rate, in addition on top of that base payment rate, because they are going to incorporate cultural language, activities or components or any of those things, they might be encouraged to want to add that into their center because that's going to add to the quality of their center. Or maybe they have a QRIS rating of 3 and they want to get to that 4, right? That's going to be an incentive for them. And then there's another answer: to work to identify and meet the needs of the family. Right, great answers. All right, anybody else have any last things you want to offer? But it seems like you get the gist of what we were talking about, and just basically how the payment rates, base payment rates or differential tier payment rates are going to affect your providers would be beneficial for them. Well, we can transition back into the presentation. So thank you for your participation. And then we'll just move on. So we want to highlight a new resource, which is the tips and consideration brief about developing childcare payment rates for tribes of all allocation sizes. So this link to the resource is in the section 6 resource guide, which we will share the link to in the chat box for you all. All right, and then we'll just move on to talk about co-payments. So another component of equal access is to ensure co-payments are affordable. Co-payments are addressed in section 5 of your tribal CCDF plan. And just note that tribal lead agencies must establish and periodically revise a sliding fee scale for co-payments based on a family size and income. And tribal CCDF grantees may not use the cost of care when determining co-payments. Tribal CCDF grantees should also ensure that family co-payments are not a barrier to families receiving assistance. So let's pause for some questions. Anything we covered so far, or anything that comes to mind, maybe on what we just discussed in our brainstorming activity?
Nazba, we had a question in the chat from Carolyn.
Okay.
It says, when providing a 5% differential rate, is that 5% of the base rate?
When you're providing a 5% differential rate, that's 5% on top of your base payment rate. And then, is there anything else you want to add to that, Sarah, or was there any other questions?
I don't see any other questions at this time. I don't see any others in the chat right now. Thank you.
Okay, thank you. All right, we'll move on to subsection 6.4. So this section covers how to implement generally accepted payment practices and ensure the timeliness of payments. The tribal aid agency must establish payment practices that apply to all CCDF childcare providers in the tribe's service area. So this includes ensure timely payments to providers, support the fixed cost of providing services by delinking payments from occasional absences, use generally accepted practices of local providers who care for children not receiving CCDF financial assistance, ensure that childcare providers are paid based on a payment agreement or an authorization for services, give prompt notice to providers when there is a change to a family's eligibility status that will affect payment, establish timely appeal and resolution processes for any payment inaccuracies and disputes. Under the final rule, lead agencies must ensure timely provider payments by either paying before the delivery of services or paying within no more than 21 calendar days of the receipt of a complete invoice for services. As a way of ensuring that payment practices are fair to providers and support high quality services, tribal lead agencies should examine their administrative mechanisms. A few approaches to consider are establishing a time frame for issuing payments, using administrative data to track progress and that made in increasing or maintaining timeliness, and seeking input from providers on ways to improve your payment practices. So the following administrative improvements are examples of strategies states have implemented to improve payment practices. Direct deposit, online training for providers for electronic voucher payment, provider self-service components in an automated system for children authorized into their care, web-based electronic attendance and billing systems. And just to note that tribal lead agencies must select which option they are using and describe their policies and procedures in their tribal CCDF plans in section 6.4.1. Tribal lead agencies must support the fixed cost of providing childcare services by delinking provider payments from a child's occasional absences. The final rule requires that tribal lead agencies must implement enrollment and eligibility policies that support the fixed costs of providing childcare services by delinking provider payment rates from an eligible child's occasional absences due to holidays or unforeseen circumstances such as illness. Delinking payments from occasional absences means paying for days when the child is occasionally absent, helps promote continuity of care by allowing the provider to retain the slot for the child without a financial penalty to the provider. Childcare programs have fixed costs, such as staff, the facilities, that must be paid regardless of whether a child is present on any particular day. So in subsection 6.4.2.1, you will check how you will support the fixed cost of providing childcare services, which include an option for an alternative approach that is subject to OCC's approval. So we are going to do another activity. So for this activity, we are going to have a small group discussion in breakout rooms that will be facilitated by your TCPC team members, and you will automatically be placed in breakout rooms by the Zoom system. And while in the breakout rooms, you will discuss the following questions and topics that are on the screen, but they're how do tribal grantees ensure providers are paid based on a written agreement or authorization, and how are providers notified of child eligibility changes that may impact payments to providers. Do tribal grantees have policies and procedures in place for improper payment issues or to handle any appeals? So your TCBC support member will take notes, and then once we return for the breakout rooms, we will recap each what each group came up with. So are we ready to do breakout rooms?
Yes, everyone will be moved to breakout rooms now.
All right, it looks like the breakout room is closed and everybody's returning. So who from TCBC would like to share out about what your small group discussion was?
I'm happy to share about our breakout room 3. So we had some discussion about what processes were currently in place and how they that there's even the agreements between the family and the tribal lead agency is shared with the provider so that everybody's on the same page and knows what to expect. And that conversations are had with the providers when a family selects them to make sure that everybody's on the same page about what payments look like, how all of that stuff is done, and give the provider an opportunity to ask questions or to share any concerns about the way that their practices are set up so that all of that can be addressed up front.
All right, awesome discussion. Thank you, Sarah. Who's up next?
Nasa, I'll go ahead. I'm just going to cover the first question. I think that was really informative, and it's something that we probably hear quite a bit. So there's a provider agreement. They don't call it an MOU or an MOA, but they just call it a provider agreement. And they are at this time putting time into updating that agreement due to the COVID situation over the last couple of years. And one of the things they're going to make sure is that the policies and procedures go in to the provider packets that they're going to be putting together. So that was real nice. I had some good responses for all questions, but I will leave it there.
Okay, thank you. And I think that maybe Carolyn was in your breakout room and she had a response in the chat that she wanted to say your suggestion on setting some parameters and our policies will be helpful, especially when there might be someone else in charge over other than herself. And she thinks she has great judgment, but may not always be there. So thank you for that, writing that in the chat. Anybody else from any of the breakout rooms from TCBC want to share out?
No, we didn't have very much discussion in our group, but just kind of spoke out and asked my colleague Carrie if she recalls where this pretty much is based within their program, and we just mentioned an example of where some of this information is at. I don't know if we just had more of TA people in our group, but we didn't get very much response. So we just talked about examples.
Okay, thank you. And it's good that you still mentioned some examples. So thank you for that. Anybody else from TCBC? Or was that it? I think that was 3 and then I was 4. Was there another breakout room? In my breakout room.
No, we only had 4.
Oh, okay.
We
Okay.
cut it down because, yeah.
Okay. I was the last breakout room, and yeah, we sort of talked about too the importance of developing or refining your agreements or your authorizations so that your providers have this clear expectation of like when they're going to get paid, and what are your policies and procedures around those improper payment issues. If you ever overpay, if you ever overpay a provider, how does your agency handle that? And maybe the provider didn't get paid in a timely manner. Is there some sort of like appeal process that they can follow? How are they going to know these things, right? This is going to be what's written in your written agreement or your authorization between you and the providers. And you also want to make sure that you notify your providers if a child eligibility changes. So you want to notify them as soon as possible. So great small discussion, and thank you for participating, and we will move on with our presentation. So 6.4.3 and 6.4.3.1, these sections cover generally accepted payment practices. Tribal lead agencies must have payment practices that reflect the generally accepted payment practices of providers who do not receive CCDF subsidies. You will briefly describe your tribal lead agency's policy or procedure on this subject. If these are not generally accepted practices in your service area, please seek out your regional program specialist to discuss them. So some examples of generally accepted payment practices include paying part-time or full-time, payment agreement, prompt notice, timely appeal processes, part-time or full-time versus hourly or smaller increments of time, pay reasonable registration fees. Because the requirement applies to reasonable mandatory registration fees, tribal lead agencies can define this standard. For example, they may establish a cap on fees that are beyond the bounds of fees typically charged or established on an annual limit on the number of registration fees paid in a year. In section 6.4.3, tribal lead agencies must either describe their policies or procedures for implementing each payment practice or Describe why the payment practice is not generally accepted in its service area or among categories or types of providers. Some additional facts to consider are your tribal lead agency's authorization for services, prompt notice, and timely appeal and resolution processes. So some questions to ask yourself are, how does your tribal lead agency ensure that providers are paid based on a written agreement or authorization? How do you give prompt notice of family eligibility changes that could impact payment to providers? What is your time frame to notify any changes to providers? How does your tribal lead agency ensure it has a timely appeal and resolution process for payment mistakes and disputes? The tribal lead agency ensures that providers are paid in accordance with a written payment agreement or authorization for services that include, at a minimum, information regarding provider payment policies such as rates, schedules, any fees charged to the providers, and the dispute resolution process. Your policies are usually a separate document from your payment agreement authorization letter. Policies help clarify what the expectations are for you, the provider, and the families you serve. In section 6.4.4, tribal lead agencies will describe the policy or procedures for their payment agreements. The tribal lead agency ensures prompt notice to providers regarding any changes to the family's eligibility status that could impact payments. And such notice is sent no later than the day that the tribal lead agency becomes aware that such a change will occur. Describe the policy or procedure in section 6.4.5. Some examples of changes to the family's eligibility status that could impact payments are an increase in household income, the family moved out of the service area, the child has excessive unexplained absences, substantial fraud or intentional program violations. The tribal lead agency ensures it has a timely appeal and resolution process for payment inaccuracies and disputes. Tribal lead agencies can consider the following information for policies and procedures. Each provider is given notice of the opportunity to appeal. Each provider is given clear instructions about how to complete the appeals process. Identify who will verify the accuracy of the information challenged. Appeals are processed in a timely manner. Providers receive a written notice of the decision. So let's pause here to see if anybody has any questions on anything we've covered. You can utilize the chat box if you have a question or a thought you would like to share. Take yourself off of mute. I don't see anything in the chat or hear anything, but if you do have a question, feel free to interrupt me. So we'll move on. To ensure you have all the information you need as you complete section 6 of your tribal CCDF plan, we have a resource directory that highlights some key references, resources, and policy guidance that may assist you with completing this section of the plan. So Teresa dropped the link to the fiscal year 2023-2025 tribal CCDF plan preprint resources, where you can find the resource directory under section 6. As we close this section of the fiscal year 2023 through 2025 Tribal Lead Agency CCDF Plan Preprint training, we offer one last suggestion that you still reflect on any of the questions that you may still have, any strategies you want to employ for moving forward, and finally, next steps and technical assistance needs. Please feel free to reach out to us if we can assist with any of your reflections or anything else. We would appreciate your feedback on the presentation. So if you could please take a minute to complete the survey, it will help us know what we can do to deliver this information in a manner that works for all participants. And so Teresa dropped the link to the feedback survey in the chat box. And tomorrow we will hold a regional meet and greet and writing cafe. If you have not registered, we will drop the registration link in the chat. So please join us tomorrow for that registration for the Writing Cafe and the meet and greet, the regional meet and greet. And then Teresa is also going to drop in the chat the office hours registration. We will have some office hours coming up. Please join those, bring your questions, anything that you may need assistance with. Those are what the office hours are for. And we just wanted to take the time to thank you for joining us today for section 6. Thank you, everybody.